And from a systems perspective, what has worked best when it comes to improving long-term adherence to lipid-lowering therapies, such as like clinical workflows, pharmacist-led clinics, digital tools, or other models? Is there anything that you found that is particularly effective?
That's a challenge. So adherence to medications, I think, is multifactorial. There are patient behavioral considerations, just simple things like making the medications part of one's routine, using things like pill boxes and reminders and apps. Those sorts of things may be helpful. Also, from a clinical perspective, so involving our pharmacists in the care of our patients. So at the point of sale, in the pharmacy, that we're encouraging patient adherence, that there are different reminders and workflows such that medications get refilled in a timely fashion. And that also our pharmacists can help us in titrating medications too. We've seen that in the hypertension space. So if we're not at the optimal dose, that we can work towards getting there. And then for the clinical workflow for physicians and my colleagues in primary care, I think just making sure that we are staying on top of the medications that we're prescribing for our patients. And so we just mentioned drug-drug interactions, and so med rec is so important. And there's so many opportunities that we have to do a good medication reconciliation, and unfortunately, it doesn't always happen as it should. And so, when patients are coming into clinic and when our MAs are rooming the patients and just making sure that things don't fall through the cracks, those are all ways that we can make sure that our patients are taking the medications as they should be.
Mhm. And when it comes to things like research, are there any ongoing outcome trials or areas of research or mechanistic studies in lipidology that you're watching closely or you're excited about?
Yeah, so I'm really excited about the trials that are looking at the LPA outcomes. And so there's the Ocean trial, there's the Horizon trial. Both of those are looking at medications that directly treat lipoprotein little a. And the outcomes include clinical outcomes like cardiovascular disease outcomes. And I believe some of the sub studies are powered to look at other outcomes like dementia and cognitive function. So it's really exciting to see what treating LPA will do clinically.
Mhm. For non cholesterol specialists listening, internists, hospitalists, endocrinologists, what are the one or two paradigm shifts in cholesterol management they most need to internalize right now?
Well, I think going back to what we talked about earlier, and just with the latest guidelines talking about lower lipid targets, I still have patients who will come to me concerned because their lipids are too low. How low is too low? And the answer is there is no too low. Sometimes folks, the different treatments will have sort of a J-shaped curve, which at the lower end, the risk kind of goes back up again, and we don't see that with lowering LDL cholesterol. And so from a cardiovascular perspective, it really is safe to lower cholesterol as low as possible. So that's one paradigm shift. And then the other, I would say, is screening with LPA, because it's not routinely done for most patients. I think it helps to guide a conversation about future cardiovascular risk.
Well, Dr. Johnson, this has been an amazing conversation.
Yeah, thank you for having me.